welcome back to the channel where we discuss all things prostate and prostate cancer related. Today I want to talk to you about preventing a urinary tract infection or a UTI. It is important to make sure that there is nothing going on down there, no infections or any of those things that could delay your recovery or keep you from recovering in the manner in which you want to. And so that urinary tract infection could catch you off guard, cause you a bunch of problems. So what are you looking for? Lower back pain. Sometimes I'll have flank pain. Sometimes it was almost like peeing rocks or just like not necessarily stones, just a weird feeling, right? And so when you are feeling those things, you need to contact your primary care physician or your urologist and have them do a urinalysis. So let's talk about how that urinalysis goes because, again, some of you may not have already had one done. The urinalysis process is they will give you a cup and you will go into the restroom. When you go into the office, do not use the restroom before you go in there because you may have to pee in the cup. So you want to make sure that you have a specimen to give. So you walk into the bathroom with this cup. There are rules and regulations and they'll tell you how to do it everywhere. And for years I did it wrong. So when you go in, you are supposed to take that alcohol wipe that's sitting there, unwrap it before you open the cup up or any of that stuff, and wipe it around the tip of your penis. All right, so once you wipe around all of that, you open the cup up. Don't touch the inside the cup or the inside or the bottom or any of that stuff. So now with your penis, you pee into the... Now, I always talk about how much you should put in there, but I put in there probably a little over half. And then I will put the cap on it, and that's it. Put the cap back on it, put your name on it in my office, and they put it back in this. I put it back in this tray, or sometimes you'll bring it back to the nurse. What happens after that? Well, there are a couple things that happen. The first thing in urinalysis is that they can go in there and see whether or not there's anything going on. So if there's something that shows up immediately, then they can put you on antibiotics of some kind. They may send it off. They grow cultures to determine whether or not there's anything else in there. Every time I go for my PSA check every 6 months, they do a urinalysis while I'm there. Make sure they do that urinalysis while you're there in the office.